We're going to be talking about specialty care and how we're continuing to expand our services to more communities in the Fort Dodge region.
Specialty care is any aspect of medicine apart from primary care. Patients will have a primary care provider that they consider to be their doctor or their provider that they see kind of on a routine basis. And then specialty care we would consider to be a little more focused. So it's nice to have access to specialty care in multiple different places. So if we can do a good job of not just having excellent care in one location, but to bring that care where the patients are, they're more likely to come, and receive the care, number one. But number two, more likely to be satisfied with what the care is. It's easier to get where you need to go and to get taken care of what needs to be taken care of.
We're going to talk a little bit about behavioral health as a specialty. What are the advantages of being able to see a licensed mental health provider in a family medicine clinic, in a pediatrics clinic, or in a specialty clinic like OBGYN?
We want patients to feel no resistance to coming to those appointments, to reaching out, to having access to care that might be really, really important for not only their health, but for the health of their patients, people around them, their relationships with their communities, and it's just really important for that care to be as easy as possible for patients to have access to.
Why do you think it's important for us to continue to expand Trinity Heart Center related to adding some outreach visits with physicians and then also adding some outreach locations like Storm Lake coming soon?
If you look at the number of patients that have heart conditions such as coronary artery disease or heart failure, it's such a common issue that patients have that there's a lot of patients that need this care in many different locations. It's one of those areas of medicine that impacts a lot of different lives. And so by bringing that from central locations into some of our more rural markets, we do increase the access. And a lot of our patients do feel really comfortable with their primary care provider, with their physician they've been seeing for years. And so it's a little bit hopefully easier and more welcoming to see somebody for that specialty care right where you're used to coming.
Dr. Glienke, thank you for spending some time today talking to us about the ways we're expanding access to specialty care across the Fort Dodge region. We appreciate your leadership in that work and your commitment to patients in Fort Dodge and throughout the region.